This is our Kent County Community Assessment done by Ashley, Stanley, Tammy, Laura, Stephanie, and Kimberly. This community assessment plan focuses on the problem of white males between the ages of 20 and 49 contracting HIV as identified in the analysis of data on Kent County, Michigan. Once a problem is identified, a community health diagnosis or problem statement is developed. This process involves identification of a particular community at risk and the associated characteristics related to this problem. This problem statement remains the focus in the development of a population-based plan designed to address the identified problems with the ultimate goal of lowering the risk for the group identified. We identified white males residing in Kent County between the ages of 20 and 49 at risk for contracting HIV. According to the Michigan Department of Community Health, 45% of all HIV cases reported in Kent County were white males between the ages of 20 and 49. Factors contributing to these findings include male-to-male sex, injection drug use, male-to-male sex and injection drug use, and heterosexual contact. Although HIV can be transmitted sharing infected needles or heterosexual contact with an infected person, the Michigan Department of Community Health reports 82% of HIV cases reported were contracted from male-to-male sex. The CDC also reports the largest numbers of new HIV infections were caused from white male-to-male sex. Primary community intervention prevention includes increasing and enhancing the education on same-sex relationships and HIV transmission and prevention beginning at the junior high level. Another primary community intervention is increasing awareness among healthcare providers. Healthcare providers need to become more open with patients when discussing sexual relationships, sexual activity, and the number of lifetime partners. We realize injection drug use and heterosexual contact are contributing factors to HIV, but we are choosing to focus our interventions on male-to-male sex due to its high prevalence as a contributing factor. Secondary community intervention prevention involves identifying those at risk. Proposed sex education in schools needs to include where to go for HIV screening, HIV treatments, and what is involved. Healthcare providers need to be able to discuss these topics with their patients openly in order to identify those at risk. Healthcare providers for adults, as well as children, need to be mindful of this. These interventions change the focus area of prevention from previous efforts. Bringing the subject once thought of as taboo to the forefront, this will encourage community participation and facilitate behavior change. Addressing behaviors to change should increase the effectiveness of the interventions and help empower the community. Changes are more likely to occur if the community is characterized by trust, offers help and support, along with high levels of involvement. We realize these interventions will be met with opposition, making them difficult to carry out, but something has to be done to address the prevalent problem of HIV in the Kent County area. Possible identified barriers include the general community, parents, teachers, and healthcare providers. This is a new area to focus on, and many people will not feel comfortable discussing these topics. Evidence has suggested that teenagers are more likely to practice safe sex when they have an open communication line with parents, peers, sexual partners, and other significant adults. Research has shown poor and non-existent communication with parents is associated with poor sexual health among teenagers. Although some parents may feel talking openly with their children about sex gives the impression that they are condoning the behavior, this has been shown to be inaccurate. We all know children enjoy and use social media. This is a possible avenue to target our intervention of increasing education. The Ambassador Program has been implemented in Kent County through the use of Facebook and Twitter in an effort to reach out to men who have sex with men and encourage HIV testing. The program offers gift cards to promote HIV testing among members in high-risk communities and has seen an increase from 1 to 6% of positive HIV. Knowing who is infected is a key in early treatment as well as in the prevention efforts. Education comes in many different forms. Schools, healthcare providers, social media, and local clinics will help with our intervention toward children. Kent County has programs and resources in place that focus on prevention, testing, treatment of HIV, geared toward the community, along with education for healthcare providers. Efforts by the Kent County Health Department and the Michigan Department of Community Health help with the increase of education aimed at healthcare providers through the theme, Be Stigma-Free of HIV. As far as our intervention, the only permission we would need in order to carry this out would be from the Michigan Department of Health. The Michigan Department of Health has prepared Michigan Merit Curriculum Credit Guidelines for Health Education that covers what the schools presenting the information is allowed, mandated, and the best practices in presenting the information to the students, which meets all legal requirements. Success of our intervention is dependent upon many factors: how well it is received by the community, how comfortable healthcare providers have become with approaching their patients and discussing pertinent sexual history information, how well parents can relate to sexual discussions with their children, how peers can relate to one another, how many people are getting tested and seeking treatment. The ecological model can be used to describe the relationship between white males and their environment that contribute to the risk of contracting HIV. According to Harkness and DeMarco, this model is based on the belief that all processes occurring within individual people and their environment should be viewed as interdependent. This model has 4 levels of influence that need to be considered in order to change behavior. The hope is that our intervention would produce a few different results. We would hope for a decrease of HIV prevalence among white males ages 20 to 49 living in Kent County, with an added bonus of a decrease in HIV among all ages. Another goal would be an increased HIV awareness among providers, along with the ability to talk comfortably with their patients about sexual issues. Another outcome would be that parents are more open to discussions from their children regarding sexual issues, and the last desired outcome would be an increased awareness from the community. We know it will take some time to see changes based on our intervention. Changing the sex education program involves not only parental and school board approval, but ultimate approval from the Michigan Department of Education. Kent County is a large geographical area that will take some time to educate healthcare providers and help them facilitate the necessary changes needed in their practices. All aspects of our intervention will take time to catch on. At the very least, we would hope to see some positive results in 5 years, but realistically more like 10 years. Tracking interim outcomes to validate the intervention is important. According to Pender, Murdahl, and Parsons, an evaluation is undertaken to learn the value of a health promotion program or intervention. Process evaluations are important tools in assessing how successful the implemented program was. These would include volume of referrals to STD clinics, number of new diagnoses, survey results at healthcare facilities demonstrating an understanding of the new education, and testing to follow school sex education to evaluate knowledge. Outcome evaluations focus on the results brought about by the program, and ours would hopefully show a decrease in HIV. Our intervention could be interpreted either as an increase in percent of population adopting the less risky behavior or a percent of population avoiding the behavior altogether. Currently, the Michigan Department of Community Health measures and tracks the HIV infection rate and reports it out based on the affected age groups. One possibility needs to be considered with our intervention. It is quite possible that the HIV infection rate could increase as a result of our intervention. HIV is a reportable disease to the health department, and if the number of people getting tested for HIV increases as a result of the focused awareness, the number of HIV cases could increase also. So at first glance, some might assume the education did not work because the number of cases increased, when in reality, more people are getting a confirmed diagnosis that had no idea they were infected before.